Starts first with Dr. Richard Brown.
Hello again. Welcome again to this podcast. This is Dr. Richard Brown, and our show is called Your History and Health Starts First. That's the new name of the show given by our producer, and it is very, very appropriate because history is very important, your health is very important, and they are intertwined. So I decided to look up history and see exactly what it said in the dictionary, although we know what history is. It's not her story, although if things had been different in the development of this country and the world, it might would be her story, but it's history. So one of the definitions, of course, is a noun, and it is the aggregate of past events. It's a branch of knowledge that studies the past. It's the assessment of notable events. So, history is pretty well understood by everyone. It's a record or a narrative description of past events. Of course, as it relates to healthcare, it's a list of past and continuing medical conditions of an individual and a family. So, health, as we've talked about before, is the absence of disease or an abnormality. It's a condition of optimal well-being, which includes your mental, physical, and spiritual condition. Your health and well-being also could include your economic and financial and social situation. So both history and health are tied together simultaneously, and they both come first. I mean, this morning was history, right? 5 minutes ago was history. And now we're in the present, right? But by the time I finish my sentence, it will become history. And of course, usually history can't be changed, but we know it can be distorted, it can be misconstrued, it can be modified, it can also be lied about. And as you know, people are trying to change or erase some history, as we've learned about some of the educational systems in this country who don't want to teach about slavery to children and young people. But so history, but it's important, and people are concerned about it, and so you should be concerned about it too, as well as your health. So history and health are so tied to each other; they both happen simultaneously, of course. Now is the present, and when I finish my sentence, of course, it will be history. So usually history can't be changed, although we know that it can be distorted, it can be misconstrued, it can be modified, it can also be lied about, and it can be erased if you let it happen. As you know, there's some people in our country who are trying to eliminate some of the history of this country as it relates to slavery and what happened during that period. Don't want that education to go to our children and young people. So but it is important, and that kind of identifies that it certainly is important. So your health is now, it's present, but each moment that passes becomes part of your health. So your health and history are inseparable and super, super important. And that's why we're going to be talking about it from now and beyond, because what's more important? Think about this. The first time you go into a doctor's office, he probably asks you several questions. And the first questions are, well, after they found out what kind of insurance you had, of course, whether you have private insurance, Medicaid, Medicare, out of pocket, then they will ask you these questions. First, they want to know what your history is. They want to know your family history as it relates to medical care. They want to know your present illness, of course. So your health and history are inseparable as it relates to seeing a physician. So a medical record is not complete unless it has included in it a written history and physical and history of present illness. If they do not have that in the record, physicians can be suspended from placing patients in the hospital. Their medical privileges can be suspended until they complete their history and physicals and complete their medical record. And so it is super important in the healthcare industry for sure. So let's concentrate on your individual health today. Talk a little bit about how to acquire it and how to keep it. Most of us, I would say, are fairly healthy. although the country is getting a little more unhealthy as we look at things in terms of lifestyle and the current illnesses that are out there, and then this pandemic that we have. But I want to look at chronic diseases, talk about that for a bit. So, chronic disease is something and a condition that persists for a long period of time. If you have a condition, a medical illness for 3 months or more, it is considered to be a chronic disease by the United States National Center for Health Statistics. So there's many chronic diseases, of course. Uh, there's heart disease, stroke, cancer, diabetes, arthritis, respiratory illnesses, there's fibromyalgia, there's depression, and several other illnesses that are considered to be chronic and that persist over time. They usually gradually progress and get worse, and they do not resolve themselves spontaneously. You may not be cured from it. As a matter of fact, today, one of the accidents, which is one of the leading causes of death behind cancer and stroke and heart disease, is not just accidental death as it relates to automobiles. Prescription painkillers is the leading cause of accidental death today in America. 200 years ago now, people didn't die from heart disease and stroke and cancer. They didn't live long enough. Plus, they weren't doing things to themselves and to their body and living a lifestyle that was inconsistent with heart health and with healthy lifestyles. I mean, but what they did die from, doing some little research, is they died from drinking brandy or alcohol. They called it in the medical record consumption, which is really interesting. Leading cause of death back in 1800s was from drinking too much. Matter of fact, they called it explosions and consumption and some other things. Also, they died from pulmonary diseases, breathing issues. They worked in mines. There was no control over the environment in terms of pollution or any of that. And the conditions were pretty harsh. The third thing was stillborn. Babies were born that died at birth. They did not thrive. So that was probably the three leading causes of death way back in the 1800s. Of course, there was a lot of gunshots and the Wild Wild West, and everybody had a weapon. So some of that took place too. Some of the chronic diseases, though, as I mentioned, are not reversible, but some are. Some you have control over. And many of the chronic diseases, ones that I mentioned earlier, heart disease, cancer, stroke, maybe even some depression, can be controlled by you changing your lifestyle. Let's take diabetes, for example. It can be reversed through diet and exercise, okay? And we'll talk more about exercise going forward and in subsequent sessions. Heart disease and stroke, diet and exercise. Heart disease is something that takes place when you have obstructions in the heart. Oxygen isn't getting there, the vessels are blocked up, and you have a heart attack. The vessels get clogged up and you have a heart attack. Stroke is when the vessels get clogged up in your brain and your head and you have a stroke. And what happens in the brain is that the passageway through which blood flows gets so narrow and the pressure gets so heavy, thus high blood pressure, it busts the vessel. And then these vessels contribute to the memory and the conditions of the brain that control motor movements. And so if you have a stroke, you may lose the use of a hand or a leg, or you can't talk for a while. So heart disease and stroke, two of the main causes of death in the United States, can be controlled, can be prevented if you change your lifestyle. Cancer, lung cancer, obvious. If you smoke, stop. Lung cancer caused by smoking a lot. Matter of fact, on the package of the cigarette, on the side of the package of the cigarette, what does it say? Cigarettes can cause cancer. but millions of people still do it every day. So that's interesting, and wonder why people still do that. But maybe they don't know the facts, which is why we're trying to educate people on a day-to-day basis. Other facts about chronic disease is this. Chronic disease will take the lives of over 40 million people in 2021, pardon me. That includes young people and those in the middle age. The total number of people dying from chronic disease is double that of infection diseases. Okay, infectious diseases, we've got a handle on, and we can cure some of those through medication and vaccines, of course. But chronic disease death takes place more than HIV, AIDS, tuberculosis, malaria, maternal and perinatal conditions, and nutritional deficiencies. 80% of chronic disease deaths occur in low-income countries and low-income people. And half of those deaths from chronic disease is from women. And since there's more women in the world than men, and then half of them are dying for chronic disease, that constitutes a disproportionate amount of people dying, which gets back to our health disparities conversations we've had, the difference between two groups of people, which is unfair and unnecessary and doesn't have to happen. So women are dying more than men when it comes to chronic disease. Now, your health is your wealth. You'll hear me say that a lot. Your health is your wealth. If you are healthy, then you can become wealthy. There are studies and statistics that show that the wealthiest people are people who are healthy. Now, there's a lot of reasons why they may be healthy as opposed to why poor people aren't healthy. Might have to do with money. I'm sure some of that is true. But some of it has to do with lifestyle. Poor people, people who do not have wealth and a means of income like the wealthy, they could change their lifestyle and be as healthy as those who are wealthy, because your health is your wealth. If you're healthy, you can achieve anything that you want to achieve, and you should remember that. So your history and health starts first. See what I did with that there? The name of the show. Your history and health starts first. So causes of chronic diseases, we'll talk about that probably in another segment, but as you've heard me say already, one is diet. Unhealthy diet can contribute to chronic diseases. And we know that many, many people aren't taking care of themselves by participating in a healthy diet, either because of their choice or the choices that they see on TV and through mass media. Secondly is inactivity. The human body is a moving machine. It must move all the time. If you do not move, if you sit and lay and do not move for hours and hours, your body will begin to malfunction. Stay in the bed for a week and see what happens. You may not be able to walk when you come out. The human body is a moving machine. So physical activity is very important. And the more you participate in physical activity on a regular basis, the more healthy you would be. The third thing is tobacco use. Again, a cause of a particular chronic disease can absolutely be stopped. And then there's age and hereditary factors. And again, the health disparities situation also can contribute to chronic diseases. So you can't do anything about getting old, but you can old gracefully. You can age gracefully. You can make sure you live as long as you possibly can. And it's in your hands. It's in your hands. Control your destination. As you've heard me say, take the vaccination. But your health tip for today is don't hesitate, vaccinate. Until next time, your history and health starts first. Thank you.
This has been Your History and Health Starts First with Dr. Richard Brown. And you can leave suggestions at ewcfacts@gmail.com. That's ewcfacts@gmail.com. This has been an EWC Communication production.